Aidan, Carey. This is my rapid trauma assessment. So as I arrive on scene, I'm going to determine that my PPE is going to be gloves. I'm also going to determine that the scene is safe. As I arrive with the patient, I'm going to consider if it's mechanism of injury or nature of illness. I'm also going to determine that my number of patients is 1. I'm going to consider additional resources and C-spine. I'm also going to clarify OPQRST and go through my ABCs and check level of consciousness. So as I do my ABCs, I'm going to check for breathing, and if they are breathing, I'm going to auscultate to hear lung sounds and adequacy of breathing. I'm also going to check level of consciousness, seeing if they are responsive, if so, if they're alert and oriented, or if they're just alert. And then I'm going to move on to my rapid trauma assessment, where my partner is going to hold head stabilization. And as he does that, I'm going to do decap BTLS throughout the whole body, starting with the skull. I'm going to check for any blood or fluid that comes onto my gloves while checking for decap BTLS. Then I'm going to make my way down to the neck, checking for JVD or tracheal deviation, also looking for stoma. And then I'm going to place both my hands on the shoulders, run them all the way down to the sternum. Still palpating pressure. Then I'm going to go back to the chest, watch as the chest rises, see if the patient is having adequate breathing. Then I'm going to go back down to the rib cage, checking for symmetry with the ribs. Then I'm moving down to the lumbar. I'm checking for any blood or fluid that is on my gloves. Then I'm gonna assess all 4 quadrants while I palpate, checking for tenderness or any pain that the patient may be feeling. Then I'm gonna check the pelvis one side at a time, pressing against the pelvic bone, sorry. I'm also, while I'm pressing against the pelvic bone, I'm checking for stability. So I'm going to check both sides. Then I'm going to move on to my legs. I'm going to check one at a time. If they do have shoes on, I'm going to cut off and check the pulse, make sure that they are having circulation to their feet. If the patient is conscious, I'm going to ask them to wiggle their toes to, again, check for circulation. After I check both the legs, I'm going to move back onto the arms, where I am again checking for decap BTLS, radial pulse. If they are responsive, I'm going to ask them to wiggle their fingers. Then me and my partner are going to log roll the patient, and I'm going to check their back. I'm going to palpate them carefully down the spine, checking for tenderness. I'm also going to be checking my glove for any blood or fluid. And after I'm done with that, I'm going to log roll them back, and I'm going to make my transport decision.